Okay, I want to start out today by just saying a few words about the interview process as a component of the evaluation process. You will be conducting an interview typically with the child's caregiver, and the question is why? Why are you doing an interview? Well, the most obvious reason is to collect background information on the client, and you need that to understand baseline data, that is how the client is functioning at the present time, and to get some clues as to what might be maintaining the speech-language problem. So background information is very important, and in fact it's a formal part. The information you gather is reported as a formal part of the diagnostic report. However, there is a second reason, and a equally important, if not even more important reason, for conducting an interview. And that is, as I see it, it's the first step in establishing a relationship with the caregiver and the client, who may be an informant for him or herself. Establish a relationship. And the only way that you can really get a full picture of the client, a dynamic picture of the client, is through, again, the information that you're going to be receiving from the client and the client's family. And the more you have a connection with the client's family and the client, the better. The more information and the better the information, and the more accurate the information is going to be, particularly about the kinds of about the area that you and I are professionals in, and that is speech, language, and communication. Information about communication ultimately comes through communication one way or another. So establishing a relationship is critical. Also, if the assessment process extends to treatment, you want who's the best person or persons ultimately to carry out treatment, or at least follow up treatment, so that there is some chance of success. And of course, it's the caregiver, the child's caregiver, the most important communicative partner. So it's critical that we establish a relationship. I think in language disorders, we talked about the Geller-Greenspan position, about approaching clients from the inside out and from the outside in, related to empathizing and relating to clients and their caregivers from the caregivers and clients' point of view and perspective, as well as from our own point of view and perspective, and in a sense working together as partners. Well, you establish that relationship, you begin to establish it during the interview process. Not only that, perhaps another purpose of the interview process is your own professional standing and development, and that is what is established during what can be established or damaged during the interview process is a sense of trust that the caregiver might have to you, the professional. You're establishing yourself as the expert and as a professional who can do an objective and thorough evaluation, an effective evaluation of the client, and would be a very good candidate for the clinician of choice for treatment. And if you're operating a private practice, or you're the representative of a particular agency, trust is critical. You're the expert. You want to be the expert that the individuals, the client's caregivers turn to address speech, language, and communication problems. You will not be able to grow a practice, become marketable as a clinician without the support of the caregivers and the clients you service. They have a lot to say about your standing in your agency and your success if you're a private practitioner. So, the interview process is important. Now, as I said, one of the components of the interview process, or the nature of the interview process, is it should involve establishing a relationship with the client, and that means that has implications for how you comport yourself during the interview process. Form. Now, that form is often sent home to the client and is returned to you by the client or to the agency prior to your meeting with for the interview and prior to your meeting the client. And it may be completed, and then you would you would have a basis for conducting the interview, and that is you would have information already on the client that you could supplement during the interview, but you would not have to fill out a completely empty form. That's a possibility. On the other hand, you could have a client with a parent like me, and I am terrible at filling out forms and terrible at maintaining schedules, so that if a form is sent home, I may never fill it out, or if I fill it out, I may not send it till, say, the day before I show up with my child. Then maybe it would not have been received at the point of interview. So you would be operating with a blank background form. Then you'd have to fill it out entirely. Well, either way, you have two choices, really, I think, in terms of how to conduct the interview. You could simply take the sheet, the background sheet, and use it as a question guide and literally read down the questions or the areas of information that are requested, and simply ask the caregiver for that information. So you could say, well, what's your name? And where do you live? Oh, and what's your child's name? Does he live with you? Does she live with you? Anybody else in the household? What's their names? Oh, pediatrician. What's your pediatrician's name? Who's responsible for payment here? That is one of the questions on the LIU questionnaire. Have you seen anybody else about a speech-language problem? Etc., etc. Just read a list of questions to the person and let them respond, and you fill in. Now, that may get the form to be completed, so you have background information on the client. But by the end of that, the caregiver will probably want to shoot themselves because that would become a long and tedious process, and that would lead to anything but a relationship. That is not the way to operate. Do not operate that way. Instead, make the interview process a conversation. A conversation. So you should familiarize yourself with the areas of information that you would require from the caregiver, and conduct a conversation related with reference to those areas, and allow the information to come to you through conversation. So now, remember, I've tried to present to you, the student, the kinds or types of informations or categories of information that you need to conduct a speech-language assessment. And those are language content, form, use, and the subcomponents of those areas, and the maintaining factors: psychosocial, sensory motor, cognitive, and medical. If you come to the interview process with that in mind and recognize that even the background information sheet is organized with reference to those categories of information, you could have a conversation. You could say, oh, hello, how are you? How'd you do? How did you find the place? Some kind of a topic initiation. You could then go on and say, well, tell me, why are you here? What is the issue? Tell me a little bit about your child. And then as the conversation goes on, your ears and your eyes, your ears are focused. You have a sense of the kinds of information you need, and you would either be jotting that down in shorthand somehow because you don't want to break the interaction with the caregiver, or you'll videotape or audio tape the interview and later refer to it and pull the information onto a form or into a report. The bottom line is conduct a conversation back and forth, as opposed to 20 questions or 50 questions or 60 questions. Keeping in mind, of course, what guides your conversation, again, are those areas of information that you need to conduct an assessment, and knowing the kinds of experiences the client has that would provide the information you need in the area. By that I mean, sensory motor functioning will be gotten, you'll get that kind of information from what? Well, from asking or talking about whether the child is, first of all, when the child's developmental milestones occurred, sitting, standing, walking, whether the child is coordinated, whether the child enjoys any kinds of sports or physical activities, again, whether the parent feels the child is athletic or not. Questions about whether the child's ever been treated for a sensory motor problem, that is, has ever seen an occupational or physical therapist, etc. Cognition. How can you learn about cognition? Well, you can't directly ask the client, typically unless you're dealing with a professional in the education field. You would not use the term, tell me about your child's cognition. That wouldn't be appropriate. But where do you get cognition information from? What kind of a conversation could you have to get that information? Well, school. What school does the child attend? How's the child doing? What are the child's favorite subjects? Play. How does the child play? What does the child like to play with? What kinds of toys? What kinds of games? Again, has there been any assessments done in the area of if the child has had any issues in any of the academic areas? Well, have any assessments been conducted aside from evaluations, regular school type tests or assessments, etc. Cognition. Speech and language. Has the child ever been assessed before, ever been treated for a speech-language problem? You should always ask, by the way, in the family, in the speech-language section of the interview, is there a family history of speech-language problems? Has anybody experienced learning disability or a language disorder of some sort in the family? That's important. In any event, again, developmental milestones in speech and language, the most important ones are when is the first word, when are the early word combinations, when did early word combinations emerge? And so on. Through conversation, you need to know languages spoken at home. You need to know you need to know who takes care of the child during the day. Often that's a babysitter. And sometimes the babysitter is bilingual or monolingual, non-English, say monolingual Russian or monolingual Spanish or monolingual Yiddish or whatever. And that's what the child is hearing 7 hours, say, during the day. Well, that's important to know. In fact, it's very important to know. So you're, again, engaging in conversation about directed towards abstracting this information on the child's background in language content, form, and use, and in the areas of the maintaining factors. Psychosocial area, friends, relatives, does the child enjoy playing with others, how does the child play, again, friends at home, friends in school, etc. There's a few words I had to say. I'm afraid I'm not going to show a videotape of an interview interaction, although when I do the course live often, I sometimes set them up between students. That's one thing you could do, is practice an interview with some friend or a colleague or one of your peers in class, from class, just to practice engaging a conversation to get background. I don't have permission on the ones that I've done for the assessments to show publicly, but just trying to get that's a very important component of the evaluation, and I just wanted to say a few words about that.